This module will describe the public health burden of type 2 diabetes, including its prevalence in population groups, its costs, and its role in the risk of cardiovascular diseases and early mortality. Discuss common diagnostic tests used to identify diabetes and identify the major modifiable and non-modifiable risk factors for type 2 diabetes. Describe and explain key aspects of insulin-dependent and insulin-independent glucose metabolism. By definition, diabetes is a condition where the body cannot produce or properly use insulin. That is, it is a chronic disease caused by a deficiency in the production of insulin, and its use to transport glucose from the blood into other tissues. It is problematic because insulin is needed to get glucose into cells. The result is excess glucose in the blood, which is toxic. As known, the pancreas is the organ that produces insulin and glucagon. In detail, beta cells of the pancreas produce insulin and monitor blood glucose. Diabetes is characterized by high blood glucose concentrations. Generally speaking, there are two types of diabetes, which are type 1 diabetes, destruction of insulin-secreting cells, heredity, and type 2 diabetes, delayed insulin secretion or impaired insulin reaction, insulin resistance, excessive glucose output from the liver. Sometimes type 1 diabetes is referred to as insulin-dependent diabetes mellitus. In particular, an individual's immune system attacks the pancreatic beta cells, so insulin cannot be produced. These patients must rely on an exogenous supply of insulin. This accounts for only 5-10% of diagnosed cases of diabetes, and it is generally prevalent among children or young adults. There are autoimmune, genetic, and/or environmental causes for this type of diabetes, and there is no known way to prevent it. Sometimes type 2 diabetes is referred to as non-insulin-dependent diabetes mellitus. It usually begins as insulin resistance, then progresses to the point that the pancreas loses the ability to produce it. Type 2 diabetes accounts for about 90-95% of the cases of diagnosed diabetes. The risk factors are age, obesity, family history, impaired glucose metabolism, physical inactivity, and ethnicity. Diabetes mellitus is usually detected using fasting blood glucose test, or an oral glucose tolerance test. Fasting test is preferable. Also, prediabetes was formerly referred to as glucose intolerance, or an inability to regulate glucose well. Among people with prediabetes, blood glucose is elevated, but not high enough to be considered diabetic. The below table lists the numbers for different categories. For example, if the fasting blood glucose is greater than 125 milligrams per deciliter, then the individual is considered having diabetes. If the value is below 100, then in normal category. If the value is between 100 to 125, then I would say this individual is pre-diabetes. Insulin resistance refers to the body's inability to respond to and use the insulin it produces. Type 2 diabetics produce insulin, but doses that are adequate, and non-diabetics are not sufficient. With type 2 diabetes, cells become less responsive to increased blood glucose. Target cells have a reduction in the number and/or activation of the insulin receptors. Thus, type 2 diabetics have to produce increasingly greater amounts of insulin to produce the same effect. There are a number of symptoms of diabetes: frequent urination, excessive thirst, unexplained weight loss, extreme hunger, sudden vision changes, tingling or numbness in hands or feet, feeling very tired much of the time, irritability, sores that are slow to heal, and more infections than normal. According to the death certificates, diabetes was the 7th leading cause of death in the U.S. in 2006, was the underlying cause of over 72,000 deaths, and contributed to a total of nearly 234,000 deaths. Diabetes has been prevalent in the U.S. In detail, 14.6 million Americans have been diagnosed with diabetes, and approximately 41 million people are pre-diabetic. In terms of race/ethnicity, the risk of developing diabetes is higher in Mexican Americans and American Indians. In addition, it is estimated that type 2 diabetes in children has increased tenfold over the last 20 years. This slide shows the estimated prevalence of diagnosed and undiagnosed diabetes in people aged 20 years or older by age group in the US in 2007. As we can see clearly, the prevalence goes up a great deal with age. The 20-39-year-old group had less than 5%, and 40-59-year-old group increased to 10.8%, and the 60 years old and beyond had 23.8%. Notably, there were 1.6 million new cases of diagnosed diabetes in 2007 alone. Among them, more than 50% were from the 40-59-year-old group. Among children and adolescents, type 2 diabetes in children younger than 10 years old is rare. The vast majority of the children younger than 10 years old were with type 1 diabetes. However, we could notice how the trends change in the 10-19 years age group. There was a dramatic increase in type 2 diabetes during this time period. Why is diabetes a problem? Diabetes is the leading cause of adult blindness, end-stage kidney failure, and non-traumatic amputation in the U.S. It increases the risk of hypertension, stroke, and coronary heart disease mortality 2 to 4 times each. In fact, type 2 diabetes is positively associated with many chronic diseases like coronary artery and peripheral vascular disease, cerebral vascular disease and stroke, hypertension, peripheral vascular disease, kidney disease, eye disorders, including blindness, toxemia during pregnancy. That is, other diseases tend to be prevalent in patients with type 2 diabetes. The economic burden of diabetes in the U.S. is great. $174 billion in 2007 alone, $116 billion on direct medical cost, and another $58 billion due to disability, work loss, and mortality. If ancillary costs associated with undiagnosed diabetes, prediabetes, and gestational diabetes are added, the total cost of diabetes in the U.S. in 2007 approximately $218 billion annually.